Okay, hello everyone, and welcome to another day of the second wave of the pandemic, Science and Society. Today, our guest speaker is Dr. Amanda Gesselman. She is the Associate Director of Research at the Kinsey Institute. Her current research interests are new trends in the romantic and sexual lives of adults around the world, the influence of close relationships on health and well-being, and how technology can be used to facilitate meaningful connections. She'll be discussing navigating sex and relationships during the COVID-19 pandemic. Welcome, Dr. Gesselman.
Thank you. Hi, everyone. Thanks for joining in today. Let me just share this screen. And here we go. All right, so my name is Amanda Gesselman, and I am the Associate Director for Research and the Anita Aldrich Endowed Research Scientist at the Kinsey Institute. I am a social developmental psychologist, so I study how people affect each other and how that changes depending on where they are in the course of their lives. So the way that you interact with your partners or your friends is different in your teenage years versus your college years versus your more adult starting a family years versus older years, and I study all of that. So today, obviously, I'm going to talk to you about relationships, love, and sex in the COVID-19 lockdown. So to start with, first I want to tell you why it's important that we study relationships. And I want to go ahead and justify this because in a lot of the writings about COVID, a lot of them have been focused more on the sort of hard sciences, as they call it, and less on the more social sciences. And obviously that makes a lot of sense for some things, but actually relationships are very, very important for our health, both mental and physical. So this picture that you're seeing right now, these are effect sizes, these numbers, and you can think of them like correlations. So the bigger the number, the stronger the relationship is between the thing like family and well-being, which is a combo of mental and physical health. And as you can see here, so this was taken from a meta-analysis, which is a study of a bunch of studies where they take lots of different studies that have looked at the same thing, and then they look at the effect of all of those studies at the same time to get a more accurate picture across all of these different methods. And so in doing so, they found that intimate relationships were the biggest predictor of well-being over and above these other things listed here. So these other things are important, but they don't contribute as strongly to well-being as intimate relationships. And here, intimate relationships means a romantic and or sexual relationship with someone that you feel close to and that you feel supported by and that you support. So sort of a close relationship with an emotional bond and potentially a sexual component. So this benefit to well-being actually is sort of, a lot of it is due to just sort of existence of a person. So the existence of just having a partner, just having someone who's there who you can turn to or call. And this is actually quite beneficial. So in studies looking at the positive health benefits of just having a partner, just having a spouse, people who were single, and especially people who were socially disconnected, so single and having less close friends, those things, being single and socially disconnected, impacted health just as much as smoking or obesity over time. So this is actually quite impactful. And if you think about those truth campaigns about non-smoking, we've obviously never seen one about dating, but according to this data, it would make sense to do it because it's just as impactful on our health. Also, compared to single people, those in these intimate relationships live longer. They have longer lifespans. They have fewer issues with substance use. They have fewer instances of psychological distress. They have less clinical diagnoses of depression and anxiety. And this is true even when they're matched across age, gender, race, income, and on personal health risks like weight, BMI, smoking, non-smoking, diet, those things. So compared to single people, intimate relationships tend to have, on average, better health. And this is not taking into account quality, it's just strictly having a person there. And some general other facts about that. So we did some studies a few years ago looking specifically at stress. And in a study of 6,000 single and partnered people, singles actually reported more exposure to stress on a daily basis. They reported just interacting with things that were distressing, or having people confront them or ask them questions that were distressing more often than people who were in partnerships. And this also resulted in greater mental health risks over time. And this was especially true for people who also reported loneliness. So people who were single and lonely had a substantial amount of stressors, and were also dealing with a lot of mental health struggles in relation to that. And last but not least, the just general presence of a partner has intergenerational effects, as I'm sure that many of you know. But children in one parent homes on average tend to have worse emotional functioning, increased aggression at school towards other children. They have lower emotional control, more frequent episodes of sickness, they sleep more poorly, and they're more likely to start puberty earlier, like around 11 or 12 versus 12, 13, 14. So this is especially important considering that nearly half of the American adult population is now single. So this is quite a huge amount of people, over 40 million people, who may or may not be looking for a partner, but who obviously aren't having these sorts of benefits that come with a partner. But the benefits of relationships extend beyond just having someone. So you can have someone, but they could just be an awful partner. And even though there are some benefits of just having that person, having an awful partner is still not necessarily a benefit, even though there are some things that are good that come with it. So the way that we talk about high quality relationships is really in terms of these 6 ingredients or components: love, satisfaction, commitment, trust, closeness, and passion. And typically the measurements or the scales that we use to assess how people feel about their relationships include questions that assess all 6 of these. So how close do you feel to your partner? How much do you think you can rely on them? How likely would it be that they would be there for you if you had an emergency? How happy are you in this relationship? How much do you want it to continue for a long time? Those are things that give us a good understanding of how people feel in their relationships, how likely they are to break up, and how likely these are to have good or bad impacts on their mental health. Obviously, these things are on a continuum, so it's not just yes or no, you're satisfied or not, but there are degrees of satisfaction, degrees of trust, and these can change over time. But the important thing to know here is that obviously these are subjective measurements. I can't objectively tell you how much trust you have in another person, but that doesn't really matter, because what actually matters is how you feel about that. So in studies looking at things like support, where people can objectively measure how much support another person gave, it really mattered how much the person in that duo felt about it more than what objectively happened. So as long as they felt good about it, it actually did have these internal benefits, regardless of what the objective observers thought. All right, and finally, when we think about our survival, relationships also have an impact here, and especially in terms of disorders or diseases or health issues that we might get as we age. So in particular, there is a huge study showing that people who had good quality relationships were more likely to be alive 8 years after a heart attack than people in poor quality relationships. This is also related to higher immune functioning, higher lower levels of inflammation, and just a host of physical benefits that generally keep people feeling healthy, less likely to be sick, etc. So people who feel supported by their partner are less likely to have higher rates of inflammation, which means that they are at a lower risk for things like diabetes. Additionally, inflammation lowers the immune system's ability to fight. So people who are in unsupportive relationships or people who feel lonely are likely to have a bit of a dampened immune system, which you can understand is very important right now in the middle of a pandemic. Other studies have found that in like cases of surgery, people with good supportive relationships heal up to 6 weeks faster, which has a huge impact on things like income if you're missing work, childcare if you have children. 6 weeks early is a lot of time to be getting back to general life. So this has relationships have a lot of internal physiological, mental, and physical benefits and implications that are really important right now in the middle of the pandemic. So I'm going to show you some data today on the the 3 studies that I've been a part of that started in March and have gone through the end of January 2021. So when the COVID-19 pandemic first started in the US, my collaborators and I were obviously, struck with the idea that this is going to be pretty serious for a lot of people. People are going to be locked in the house with their partner, whereas they used to be able to have time apart, have things to talk about, experience things separately where they could come back together and, have a conversation, tell new things, not get bored with one another. But also being locked up in the same house with people that you maybe weren't as happy or satisfied with before the pandemic. Now being locked up with them is probably likely to increase that. So the COVID-19 lockdown really had a lot of sort of different directions in the way that it could impact relationships. So people who were really happy in their relationship at the beginning might actually benefit from being locked up with their partner or being sort of sequestered with their partner. But people who were very unhappy or people who were single but very much trying to find a partnership obviously are now suffering the consequences of this lockdown. So we're very interested in figuring out what's happening with people's relationships, but also what's happening with single people. Are they trying to date? But beyond dating, mental health, are most single people able to continue keeping their social network going regardless of having a partner or not? And what does that look like over time? So what do we think that the pandemic will have in terms of long-term consequences to love and sex? All right, so the first thing that we'll talk about is the early days of the pandemic. So we started this survey at the end of March 2020, and this was about a week or two after the US really started to report on COVID as a pandemic. So this is when we were all starting to go into lockdown. So here we asked people lots of questions about their relationships and sexual lives. And right here, this is just people who are in relationships. So no singles here in this data, in this current graph at least. But we asked people about their relationship in general, and then also about their sexual relationship, because sexual satisfaction tends to heavily influence relationship satisfaction. So if you're sexually satisfied, you also tend to be more satisfied with the relationship in general. So we're really interested in seeing both of those things. So you can see here that a number of people reported declines in both their romantic quality and their sexual relationship quality. So around 1/3 of people for both reported a decline. Most people at least in terms of their general relationship, reported staying the same, that nothing improved, but nothing declined. However, for sexual relationships, it seems that for the most part, things declined, with very few people reporting an improvement, although it is 17%, so this is still 1 in 5 people. So this isn't looking necessarily great, and this is right at the beginning of the pandemic, only just a couple of weeks in. So when we first got this data, we were obviously a bit concerned with how it looks. There are a lot of people reporting declines, and this was, only a few weeks in. So if we were, at that point, we didn't know how long lockdown would last, obviously, but it seemed like it was going to last at least a few months. And so at this point, seeing that things are declining already, it was looking a little dire for sure. And so question looking at how you would describe the quality of your sex life, but we separated it out by sexual orientation because that actually was a big differentiator in how people felt. So here the blue bars are people reporting that the quality of their sexual relationship got worse. And you can see that this is especially the case for gay men and lesbian women. For both gay men and lesbian women, the majority of them reported that their sex life had declined. And beyond just this one question, in the rest of the survey where we asked about things like frequency of sex and things like trying new things or sexual desire, how much they've actually wanted to have sex in the last 2 weeks or so, all of those things also declined for these specific subgroups of people. And so not only was the report of the quality declining, but also they were having sex less often. They were feeling a little less affectionate. They were feeling like they were less romantic. They were just generally feeling a bit more struggle with these sorts of things. However, it's not actually as dire as it seemed, at least from those sets of questions. So in the same survey, we also asked people these 4 questions. How satisfied do you feel with your relationship? How committed do you feel? How satisfied are you with the sexual relationship? And how much do you argue or get on each other's nerves? And as you can see, almost the whole sample felt satisfied and felt committed to the relationship that they were in. So people were very happy with these relationships, even though they reported a decline in the quality of both the relationship and the sexual relationship. Also, nearly 3/4 of people reported that they rarely argue or get on each other's nerves, which honestly was more than I thought would report that, considering, 2+ weeks of just being 24/7 together. But that actually was pretty high. People really rarely reported arguing, and that didn't change across demographics, across age, across gender, across sexual orientation. It just, people generally were rarely arguing. Okay, so those were the early days of the pandemic in March. And since then, we've done several surveys. So for that particular March study, we actually surveyed people once a month for 5 months. So the March data was the first, and then we continued through August. And then in August, we did a separate survey, just looked at sort of a check-in, like how things are going mental health wise, and also some things about how worried people are for their own personal health and their financial health, but just a more of like mental health check-in rather than a relationship and sex check-in. So from almost a year in the pandemic, and this was collected at the end of January. The last day was January 31st. So these are relatively fresh data, looking at a year in. So the first thing that we asked, of course, was relationship satisfaction in those questions that I showed earlier. And some people did report some change in their satisfaction over time. Overall, the group didn't really change. There really wasn't that much change in relationship satisfaction from March 2020 to January 2021. There were, of course, a little bit of fluctuations, a little bit of up and down, but for the most part, it stayed steady. However, there were some people who experienced more downs than everyone else. And these were people who, at the beginning of the pandemic, reported more arguing to start with. So they were people who were already arguing in their relationship before the pandemic began, and people who reported being dissatisfied. So if people argued but were still satisfied, didn't matter, that still created a lot more downs than ups. And people who were dissatisfied but not arguing also experienced that. So there were definitely effects for both of those things. But in general, people for the most part felt just as satisfied as they had a year ago. Okay, so in the face of that, showing that relationship satisfaction is high and people are feeling, relatively good about their relationships, even in the face of this year of traumatic, unprecedented chaos, we do have some reports of a little bit of a different story. So yes, people felt good about their relationships. Things haven't necessarily changed. People are still feeling invested and committed and relatively happy. However, there's some room for some different behaviors there. So we were interested in seeing whether or not the pandemic was associated with people sort of considering alternate lifestyles, I guess is the best way to put this. So are people daydreaming about being single instead of being locked in with their partner, or are they thinking about other partners? Do they wish that they were with someone else? What are people doing? And this was especially interesting to us because we've in the surveys that we started in March, we had an open text box at the end, and a lot of people told us that they felt really guilty because they were fantasizing about other people, or they might have just had a fleeting thought like, my life would be so much better if I was single right now, but then they felt so much guilt about it. And that was that seemed to be like a common thread for us. And so we were wondering whether or not that was, the norm. Is it that most people are really just doing this, and that it's okay that people are feeling guilty but really shouldn't be because it's kind of normal? And the answer to that is kind of yes. So it seems that about a third of people reported that they fantasize about having sex with someone other than who they were with at the time. And this was especially the case for bisexual men and bisexual women compared to other men and other women. So it does seem that it's relatively normal. Nearly half bisexual men reported this, and nearly a third of everyone else except straight women, which is 1 in 5. In terms of whether they would have been single with someone else, although lots of people did report declines in quality and some, fantasizing about other people, generally the response was that they would not have been happier if they had been single. So both relationship satisfaction and commitment and investment stayed relatively stable. And although they were thinking, maybe had these fleeting thoughts about other lives that they could be living or other people they could be with, generally most people said that they would not be happier if they'd been single. And although I don't have it here, we did ask them if they fantasize about leaving their partner, and if so, if they would do it. And only 2% of people said yes, that they would leave their partner after the pandemic. So it seems that for the most part, although things have been just chaotic and stressful for everyone, for the most part, it seems like the sort of like relationship story here is actually one of stability, surprisingly for us. And this is how this looks across age groups. I thought maybe this class would be especially interested in seeing it spread out like this, because it does seem that younger people are especially likely to say that they would leave their partner. And these are actually significant differences, these compared to these other age groups, although not necessarily a large effect. But younger people do seem to be happier in their relationships than older people. And this was true also in terms of satisfaction and commitment, and also in terms of conflict. So younger people were less likely to be fighting with their partners than older people. They were less likely to have reported being happier if they'd been single. And they were more likely to report that they feel more affectionate towards their partner after being in this pandemic with them for a year. So there does seem to be something positive for a lot of younger people in relationships. And this is bisexual orientation if you're interested. For the most part, things are relatively consistent, although bisexual men were significantly lower than the rest of the groups in terms of whether or not they would be happier. So bisexual men were more likely to say yes, although half of them said no. All right, so a year in, we are obviously putting together more surveys because the pandemic is still ongoing. Obviously, we're getting vaccines now, but the vaccine, depending on which one you get and all kinds of different details, the vaccine really only protects the receiver. So it makes the pandemic less dangerous for you. And so a lot of people have misconceptions about how much that will protect their partner or potentially multiple partners if they're trying to date. And so there are a lot of things that we want to be able to monitor and give data to and be able to say people are doing this and here's maybe how we can help, or here's how that could be a good thing. So we are still documenting this and following people. But at this point, a year in, the story seems to say that for the most part, people's relationships have been stable even through all the chaos, and that people who were satisfied in their relationships generally. However, people who weren't satisfied in their relationships, people who fought, people who just generally didn't feel very affectionate or very cared for, are more dissatisfied now than they were before. So if they were already dissatisfied, already not having a great time, it only got worse from there. So it seems like, even though things are getting worse, that's still a story of stability in some way, that they haven't gotten better. They've just maintained that sort of poor quality, and obviously that isn't good. So maybe when the lockdown lifts, we might see more breakups for those people who are dissatisfied, and maybe we'll see them get into something more healthy. Those are things that are important to keep measuring. But regardless, it does seem that there's some level of stability here. And it's important to keep in mind that everyone is living through this. And so considering it's completely unprecedented and no one knows how to handle this, there are a lot of sort of like miscommunications between people in relationships, at least what we've seen in terms of like what people will report in the survey, in that they feel awkward or uncomfortable talking to their partner about how worried they are about the pandemic or like quarantine or things like that, because they think their partner will be upset or, not meet that positively. But because it was written by so many people, it seems like a lot of people are feeling that way. But if one would just break the ice, both of them could be talking about the same thing. So I just think it's important that everyone is going through exactly the same thing. And, this could be a step in the right direction to just break the ice. Okay, and last but not least, I just wanted to show you some brand new data that we just collected that I didn't have time to make some graphs for, but recently we asked people, what relationship do you hope to pursue once the pandemic is no longer a threat? And these were single people from 18 to 45. And the sample was based on the census. So although this is an internet survey, which means people who don't have access to the internet aren't represented, obviously, but it is based on the census in terms of age, gender, race and ethnicity, income, region, etc. And so this is a pretty good idea of what single America will look like after the pandemic for people between 18 and 45. So about 18% of them reported that they don't plan to pursue any relationships, and friendships were definitely the number one thing that people were pursuing. And this means friendships with new people, not like friendships that you already have. But it seems that people are really excited to just seek out connection generally, and that includes friendships. Another thing that we saw is that committed relationships tend to be the standout, and this is actually higher than it has been in the past before the pandemic. So when we were looking at people within this age range and asking them what kind of relationship they're looking for, generally only about a third say committed relationship, and the rest of them fall somewhere between I don't want anything and I just want a casual hookup, etc. There's like some continuum in there, but only about a third of them say committed relationship. And so this increased to 52%, although it could, be explained by many factors that we don't know and we didn't measure. It does seem like people are maybe going to come out of the pandemic with more of a drive to find like a real connection, whether or not that means, we're Facebook official and plan to be together for a long time. But it does seem that people are actually pursuing something that will lead to an emotional connection and less likely to be things like uncommitted one-night stands. All right, and that is it, I think. I am happy to answer any questions, but you can also email me or find me here.
Excellent, thank you. We have a lot of questions, so
I saw them pop up.
A lot of time, yeah. So I want to start with a few clarifying questions. At the beginning, you were talking about the health benefits of intimate relationships. And so students want to know, does intimate relationship mean having a romantic or sexual relationship, or does it include other things as well?
Yeah, intimate relationship means romantic and maybe sexual. It's sort of understood as like the opportunity for sex, but doesn't necessarily have to be acted upon, but it is romantic relationships. So these aren't like friendships, but they can be like more than one person. You can be like polyamorous or some kind of consensual non-monogamy, but they are romantic.
Okay. And so then in terms of the health connections that you showed us, are those correlations? A lot of the students have questions about like trying to understand that, because potentially, like, for example, you also talked about children in one parent households, and we know there's a lot of other things that may be connected, so the cause and effect there is not necessarily as strong of a relationship as the correlation. So can you talk a little bit more about that, about how we can understand this in terms of if it is actually being single that leads to health considerations, or if there are other ways to still be healthy and have good mental health despite the fact that you're single?
Yeah, of course. So the picture that I showed earlier, which I would show now if it would let me exit this, is this one right here. Nope, not that. This one right here. Yeah, okay, so this is from a meta-analysis, and these are like correlations. These numbers are actually effect sizes that they calculated through like through the statistical procedure for meta-analyses. So they are like correlations in that they show magnitude. So bigger ones obviously mean stronger connections, but they don't go negative. So it's just from 0 to 1. But anyway, these are, the way that this is interpreted is that the studies that they pulled had measures for both intimate relationships and at least some of these other things. And so they were able to compare across, I don't know, like 30 studies or something, the general effects, the general like contribution of each of these things to well-being using the same well-being measures, if that makes sense. So these things also contribute. It's just that this one tends to contribute more. So if you have a really crappy intimate relationship and you're fighting all the time, that is more likely to contribute to negative well-being than having a bad day at work or having like a bad week at work, for instance.
That makes sense. But at the same time, then obviously we can see there are lots of other ways that you can have a single person who's healthy, who has good mental health through these other.
Yeah, of course.
Yeah.
And also I want to say that not all single people want a relationship. So relationships and pursuing partners do tend to be some of people's like primary goals when you ask them like what they want in their life or what they want in the next 3 to 5 years. Usually like 91% of people will report a relationship of some sort like that, an intimate relationship. However, there are people who are happy being single. They're called, there's a term for it. It's like voluntary singles or lifelong singles or something. But that's the person who studies that. Her name is Bella DePaulo, and she has been studying people who are just happy being single for their adult lives, and they have rich friendships and social lives. And her whole line of research basically shows that as long as you have that and you're not upset that you're single, you're not like begrudgingly single, then actually your health and happiness is pretty equal to people who have good quality relationships, as long as you also have those good quality non-romantic relationships.
I think that's such an important point. Yeah. I mean, what you just pointed out about being, begrudging the fact that you don't have a relationship or feeling very negative or, having any sort of negative feelings associated with that lack of relationship. I could definitely see how that then is associated with these health outcomes. Yeah, that's great. So another clarifying question. So you gave the sample size for your study of 2,000 individuals. So students are wondering, what's the breakdown of that? And in particular, and also a few more clarifying things about like sample size. For example, you pointed out bisexual men and bisexual women fall a little bit differently on the continuum from what we see in other groups. So what are the sample sizes for those groups in particular? And also, were all of the people, and I'm sorry if I missed this, but were they all in committed relationships where they were living together, or could there be some variation in this based on the status, not just the status in terms of how happy they were in the relationship, but like literally the status of whether they were living together or not, or committed or not, those sorts of things?
Yeah, definitely. So first, the 3 studies, all of them had at least 1,400 people. So the one that we started in March that we surveyed people every month had 1,400 people. And because we recruited from the Kinsey Institute social media, that sample actually was a lot more queer than we would get otherwise. And so actually about a half of that sample identified as something other than heterosexual. And almost a fifth of that sample identified as transgender, which is really awesome in terms of being able to just like be able to put that data out there, because that's such a rare thing to have and to be able to put out. For the other ones, the Singles in America one from August and the Singles in America one from August has 5,000 people. And it has about 300 gay men, 300 lesbian women, 300 bi men, 300 bi women. And then the 2,000 person sample from January has about, I think about between a quarter and a third of that sample, I think, is non-hetero.
Okay. Yeah. I mean, I guess one of the questions is kind of about to what extent variation in sample size between these different groups could lead to this. And I think importantly, some of the comments from the students are really pointing out the fact that even within the bisexual groups, male and female, they are still unlikely to break up, right? Still 50% of them are wanting to stay together and are satisfied in their relationships. Yeah, great. Okay.
So it's like 2% of people who would actually break up or leave their partner, even though so many of them have thought about someone else or thought about leaving. It's still very few of them would actually leave. It's just, I think that obviously a year of this stress is going to cause problems in lots of areas of life, and relationships are one of those areas. And so I think that a lot of aspects of the pandemic also hit non-heterosexual people harder. So there are a lot of studies showing that gay and lesbian and bisexual people have lower rates of vaccinations already. They have lower rates of being tested, and also lower rates of just being campaigned to about information or where you can even get the vaccine. And so there are a lot of other things that go into those differences. I think that there are a lot of other things that are just bigger or more present stressors for people who identify as any minority group. And so I think we have to keep that in mind.
That's a great point. I mean, I think, yeah, in terms of just, us being stuck inside trying to deal with this, everybody has different levels of other stressors that could then add to them feeling this desire to kind of go somewhere else or fantasize about being someone else or somewhere else. Yeah, I think there's so many layers in there still.
Yeah, and I think another thing to think about is a lot of people had to move back in with family. And so if you are a person who is not heterosexual and you are not out to your family, that's the struggle. Or if you are and they're not supportive, now you live with them again, and that's a huge struggle. And so I think that there are just a lot of contributors to a lot of stress. And also that reminds me of your other question about living together. So the people in committed relationships didn't have to live together, but I did ask that so that I could control for that in analyses. We did see some differences by that, although a lot of things weren't different. So satisfaction was the same, commitment was the same. People who did not live together actually argued a bit more, but generally the sort of levels of most of the things stayed the same. It just seems that people who were not living with their partner seem to be a bit more worried about it than people who are living with their partner, like worried about the pandemic's effect on their relationship, but aren't actually experiencing worse things for the most part.
Yeah. Okay, great. So actually, I want to talk to you. There's a lot of questions about single people and how to navigate dating and sex during a pandemic also. And I know that you've done research on that. So do you want to give an opener, and then I can ask some specific questions?
Yeah, sure. Yeah, so I didn't cover the single stuff today, but obviously, because half of the population is single, it's important to understand what people not in relationships are doing. And especially in terms of singles dating behavior, at least right now, because it is dangerous to meet people in person. And that means that a lot of people aren't. And for the people who are, they are causing themselves a lot of health risks and causing a lot of other people a lot of health risks. And so there are just a lot of reasons to observe behavior and see what's happening, basically. But one thing that we were really interested in was online dating, because before the pandemic, it actually had become the #1 way to meet a partner across all demographics in the US. So regardless of age, younger, older, that was the #1 way they were finding partners, regardless of race, income, etc. And so this really was already the way to date. And so as the pandemic came through and made it so that people couldn't meet in person, online dating was still there. It was just that the next step isn't there. And so because so many people were using it, we were really interested to see, okay, are people just going to keep meeting in person because that's sort of the script for online dating, or what's going to happen? And as it turns out, people started using online dating more, especially people who were under 30. So people who were between 18 and 29 were more likely to be opening their apps and spending more time swiping. They were spending more time per day messaging. They were more likely to be messaging more people. And they often reported that they were messaging with people that they wouldn't have otherwise messaged with had the pandemic not happened. And so it seems that people are a lot more active, they're a lot more engaged, but they're not meeting in person. So only about 4 or 5% of people said that they were still meeting online dates in person like they were before. And so that's not really happening, but people are still engaging in these, in the online dating environment and making these connections. But what it's turning into is more like a long-term text-based relationship, or like or they go on video dates or something. And so it still ends up being kind of kind of dating, but there's no face-to-face component. So they're still like doing these dates and figuring out how to do that, but it just looks different. And so I think that probably when the pandemic has abated a little bit, we will probably see a bit of a spike in dating because people are so ready and they've been, just waiting to meet in person the whole time. But it might be that a lot of those people already have someone in mind that they've been talking to this whole time. And so it's really just about meeting that particular person.
Yeah, I was going to say, is that the 52% of people that are like, well, I want to be in a serious relationship because I've been talking to this person for 14 months and I'm ready to dive in.
Right. Yeah.
Yeah.
I feel like it's it's interesting because one of the biggest complaints about online dating before the pandemic was that you just chat and chat and chat and it never goes anywhere. You never meet in person. That was one of the top complaints. And now that's all you can do. And so it's sort of forced people to be okay with that, I think. And so people are now reporting that they're having more meaningful conversations. They're having more emotionally deep conversations, and that they've sort of figured out a way to like get a good vibe check over someone. So like they'll do a video date, or they'll like engage in some specific conversation or something, and they've really figured out how to like weed out the ones they're not compatible with that way. And so I think that we might end up seeing like a bit more picky dating, or more like specific dating, I guess is a good way to say that. But it does seem that people are ready. So
that's interesting. I'm glad you covered the apps because several students had specifically asked about that, the use of apps. And I guess a follow-up question to that then also is, I mean, you talked about people, having it's shifting how people are using online dating apps and kind of having more meaningful relationships or interactions over them. Are there also people who have reported a lot of dissatisfaction, or the fact that they have created these relationships but they can't actually see each other is leading to more dissatisfaction?
yes, sort of. So it seems that people who report a lot more dissatisfaction with that just stopped using them, or will stop using them, I guess. So we saw not a lot, but we did see a percentage of people just stop. They just took time off or shut it down in some way, and they haven't gone back because in their eyes there's no reason for it. They want to meet in person to date in person, so why do this right now? And so I think that has in some ways like kind of worked itself out in that way, although certainly they're probably dissatisfied because they were trying to find someone. But for the most part, it seems that people who are currently doing the online dating thing, like everyone understands, like everyone's doing the same thing, right? And so everyone understands that it's hard to meet in person. But I think people who are on there are still, you still want a connection. People are motivated to make a connection. And so it's what you can do right now, basically. It's sort of the way to find a connection if you're going to make one. And a lot of people are doing it like via video date, and people who do report doing video dates are really likely to report that they want to keep doing it after the pandemic. So if you haven't done that yet, it might be something you want to get used to or try out and try to get comfortable with in some way. I will tell you that most people reported that the thing they're most comfortable doing during their video date is ordering takeout and eating it together, or making like an alcoholic drink and drinking it together on the thing. And 1 in 10 said that they wanted to work out together, which personally sounds horrible to me, but if that's what you're into, find your 1 in 10, I guess.
Find your 1 in 10, that's perfect. Yeah, that's great. So it sounds like dating apps, also video dates are good suggestions for single people right now. Are there other top suggestions?
For right now, I feel a little uncomfortable suggesting anything that would be dangerous in any kind of way. And so I think that the video dates are a good start. I also think that, outdoor dates where you can be social distance from other people are great. And actually, a lot of people said that they would be just fine wearing a mask on a date if someone wanted them to, or if it was needed. That doesn't seem to be a problem at all. People are very open to that. And so it seems like people are willing to do whatever is safe, but I would be a little cautious until it's a bit safer to do so.
Yeah, that's great. And do you think that these online relationships fill some of the health benefits that you get out of having an in-person relationship?
Yeah, I think there's a lot to be said for that. I mean, certainly there's a lot of rejection in the online environment. You can get ghosted, or just like there are just so many people that it's easy to be, there's a lot of rollover basically. But I think that the online dating environment can provide some benefits, even if you're not necessarily connecting with one person very strongly, because it does give you social interaction, which just in general releases neurotransmitters. It releases some like reward feelings, and it just gives you like kind of a boost, which is nice. I actually had this conversation with a reporter for the New York Times, I think, who was really interested in why people are enjoying those like really quick social interactions with like cashiers at the grocery store. And like she in particular wanted to know why she thought it was so fun to flirt with them. And I think it's just because you're getting this boost of social interaction where you feel, even if you didn't make like a deep connection where they know all about your childhood, like, you've made a connection with someone, and that makes us feel good. That gives us a boost. And matching with people is a good self-esteem boost if that's what you need for the day. We're all struggling in some way. But also it's a good way to find people who like what you like, who understand where you're coming from. It puts you in contact with so many people. I think you could probably find someone who provides that support for you in some kind of way, however they might do that via non-face-to-face internet venue.
That makes sense. Do you know if there are any data or studies about long distance relationships during COVID? Like for people that were already in a committed relationship and then they were forced to stay apart?
Yeah, I feel like a good amount of people have that problem, but I don't know anything that has looked at that right now. I think that there's some stuff looking at like how to incorporate more like online novelty into those things, to like do different things together so that you can sort of spice it up. This isn't the right word to say, but you know what I mean? But I don't know anything that's been that's looked at people who are forced into long distance.
Okay, interesting. And then of those relationships that you studied, or even other relationships, I mean, I know you talked about very few people actually want to end their relationship, but some students were asking if there's any data from the public at large about the percentage of breakups during this pandemic as compared to like the year before, for example.
To the year before, I actually don't know the answer to that, unfortunately.
Or to like a normal year. They said normal year, and I wasn't sure what to make of that, so I said the year before.
No, I got it. Yeah. I actually don't know what the percentage is for like a normal year in terms of breakups, but there actually weren't that many. And so what happened with the relationship shifts is that if people were single or casually dating before the pandemic started, they were more likely to stay single. But if people were had like the beginnings of a relationship, like they were sort of dating, like going on multiple dates with one person or something, those people were more likely to get into a relationship. And people who were already in relationships were more likely to shift towards more commitment. And so we did see more engagements and more weddings and marriages and whatnot, because there's been more of a shift towards that commitment. But I don't know how many people like broke up compared to last year. It seems pretty low. And divorce rates in the US right now are pretty low as well. Although we do know that in China, the divorce rates did spike after they came out of lockdown.
Interesting. Okay. And then on another kind of less nice note, several people have questions about domestic abuse. I mean, we've heard in the previous version of this class from people who work on intimate partner violence. And so I guess some of the questions are about, has there been an increase, have you in your data or generally seen an increase in sexual assaults, or a decrease maybe, because like, for example, on college campuses, there's less opportunity to interact. So what are some of the data around domestic abuse, but then also sexual assaults outside of the home?
So my colleague here, Zoe Peterson, does work on sexual assault, and has done some work on that in the last year with COVID. And not sexual assault, safety within the home. So domestic violence and sexual assault within the home. So marital rape or relationship rape, etc. And that data has shown an increase. And so people are, women especially, are experiencing an increase in violence. And that also seems to stem from a bit of an increase in male aggression, especially for low income couples and families, because of, there's no excuse for violence against anyone, but because of the economic fallout, there is a lot of issues in the lower income society right now, and that's especially true for low income men in relationships. That appears to be related to an increasing in aggression right now. In terms of sexual assault outside of relationships, I actually don't know the answer to that fully, but I have seen some reports that the reporting of sexual assault has gone down. And so obviously the great majority of people don't report, but I would guess that also like not being outside or like around other people probably had a decrease on that as well.
Yeah, absolutely. I think also with the low income communities, there's less, if you already are in a low income household and you then lose money, there is less, and all of the shelters and everything are closed. There's opportunity for women to get help, or people who are being abused to get help in those scenarios, which I think then just further complicates it, regardless of, other behavior. I think.
And you can't get a new job. It's so hard. So
yeah. Okay, so a lot of people want to know what, you kind of mentioned this a little bit with virtual dates, but aside from virtual dates, what about dating life during a pandemic is going to stick around after the pandemic? What's just going to become a normal part? Or like, how long will it take us to kind of change back, or will we never change back?
Sure. I think that dating will look a lot like it did before the pandemic, but here are the areas I think that will change. First, we have no idea how long we'll need to be wearing masks or doing like PPE type stuff, right? Like it might be the case that we have to get a vaccination once a year, like the flu, where we also might have to wear masks around that time. And so there are a lot of things that might linger and stick around, and because of those things, we might see related things stick around. So if it becomes the case where COVID is something that we have to worry about on a yearly basis, then we're likely to see these, these like reliance on technology and these like sort of more distance relationships. Those are probably going to be a bit more commonplace than they were before, because we're now having to adapt to this new world of infection, basically, and contagion. So I think that depending on what happens with that, we might see some differences. People are absolutely reporting that they think after the pandemic that they will take longer to get to know a person before they start dating and getting in a relationship than they did before the pandemic. And people are especially reporting that they have really, during this pandemic, they have really taken time to think about what kind of partner that they want or what kind of relationship they want. And so I personally think, and again, speculation, but I personally think that when the pandemic is over, societally, we've been sort of obsessed with the idea of hookups. Like that's in all of the media, and like, we're like a hookup society. That's like the thing with college campuses and everything. We've very much been on that train for a while. And I think that once the pandemic abates, we might see more of a change towards more like actual emotional connections. So it's not to say that, sex just for sexual gratification is going to go away, because that's been here forever. But I think that there will be a prioritization on feeling like you have someone who understands you and feeling connected with that person. And even if that means that you're not, committed and exclusive, I think that's what people will be pursuing. And I think that that's a difference that we're going to see after the pandemic is over. We asked people, like, how likely are you going to be to pursue, sex with multiple partners after the pandemic? Not like at the same time, but, having sex with different people in the same time period. And I think the percentage was like 15% of people, but the rest of them are really very much focused on friendships or close emotionally connected relationships. So I think
Wow.
that would be the trend.
Yeah, that's fascinating. That's a much lower number than I would have expected.
Yeah.
So on the note about friendships, students were wondering how, you've talked a lot about how COVID-19 has impacted romantic relationships. Has it also impacted platonic relationships or friendships in the same way?
I want to say yes. So I don't do that research, but there is someone who did a study on friendship during COVID at Kinsey, and we also included some questions in our own survey about like, have you lost touch with people that you were close to? It does seem that a lot of people are moving out of friendships. So people who were friends before, but maybe weren't like as close as they used to be or weren't close generally, it seems that those have sort of faded out a bit. People are reporting like more friendship transitions, if that makes sense. So they may have found a different friend during COVID that they've just gotten closer to and have sort of spaced themselves from their old ones. And I have seen several participants report that in terms of like, I've made a friend. It might be someone that they already knew or like that they've just met, but they've made a friend online who they talk to online all the time now, or they text all day. They don't necessarily like see each other in person and didn't necessarily do that beforehand, but now this has become a really important friendship for them. So I have definitely seen some data for people sort of losing old friends, but there's also some data to support friendships becoming stronger.
And in terms of maintaining those friendships or building friendships, and maybe more appropriate for you, maintaining or building new romantic relationships, do you have any tips? I mean, students were asking like what tips you have for improving the relationships that you already have.
Sure.
And yeah, I mean, general things about, recommendations you have either for improving a relationship that got very bad and stressful during the pandemic, or like just strengthening ones that are already okay.
Yeah. So for just like strengthening ones that are okay, or like friendships or romantic relationships, either one. I know this sounds kind of like a little silly, but one of the biggest things that works for people in relationships is this introduction of novelty in some way. And so if we weren't in the pandemic, like one good thing to do would just be to go somewhere with your partner and do something that neither of you have ever done before. And so now you have to figure that out on the internet. But I have a friend in the field who studies things like online virtual games that both people can play from different areas, or there are also like sex toys that can connect to the Wi-Fi and one person can control it from anywhere in the world. There are like virtual reality type things, both sexual and non-sexual, that you can play. But the point is, when you do something that neither of you have ever done before, it creates, first of all, it creates like a physiological change that is like arousal and excitement, not sexual arousal, but like, physiological arousal. And that is related to this like neurotransmitter release, the release of dopamine and serotonin, then like rewards and happiness. And so both of you get sort of a happy kick out of that, but also the doing something brand new together, that really has an impact on like the strengthening of bonds. And so even if it's something like silly, like going, like my friend took his partner zip lining once, like just in the woods in Brown County, which you may have been to before, Krista, but that's like, that works for some reason. Not for some reason, I know why that works. It works physiologically for physiological reasons, but that actually is like a really good way to build emotional connection and to sort of like spice it up, even if it's something silly, some stupid online game. Just doing something new and different is good for your own personal mental health, but also good for building the relational bond. In terms of for relationships where people have already had a lot of conflicts, those are hard. So those relationships often are struggling because of communication issues. And that's not to say that the people in the relationships haven't tried to improve them, but there's generally a disconnect in terms of like being able to express what you want and what you need in a way that is taken as not an attack and responded to in that way. And that is where a lot of couples suffer. And so it's hard to tell people what to do for those kinds of relationships, because that really is the issue. And telling people that they need to communicate better is never, like, no one's ever happy to hear that. So it takes a lot of work to figure out how to be able to broach those topics. Like, I did see a lot of people asked about how to communicate with their partner that they don't like what they're doing during the quarantine period, that they're being dangerous or hazardous. And those are really hard because people get defensive, or they think that they're being attacked, and no one wants that. That's always going to be met with a negative reaction, and that's never going to like make a change in any kind of positive way. And so it really is based on the dispositions of both individuals. And so it's really hard. There are certainly lots of places that you can get like online couples counseling now, like Headspace and things like that, Talkspace, I get. But I would encourage you, if you don't want to do that, you don't have the money, I would just honestly do a little internet research about just like ways to open up the conversation, ways to, show a person that you're not trying to attack them, that you just think that this is important to say. I know that sounds like really like touchy-feely and whatever, but it really does. That really is like a huge contributor to whether or not a relationship will last. And so it's important if you can take the time to do it.
Yeah, I think so often communication is something that's really hard for people to approach. And then if they're able to do it and do it well, but it does, having a difficult conversation also requires you being in the right headspace. Yeah. Right? Because that allows you to talk about it in a different way. And on that note of just kind of how from day to day, the stressors during the pandemic can make us feel different ways. Some students were wondering, like, with your surveys, is it possible that the day after someone took it, they would have given totally different answers, since we're in this time right now where it really does feel like life is just, veering back and forth from stressor to stressor.
Yeah, that's a big concern, certainly. The way that psychologists try to handle that is, first, there's like there's a difference between like measuring something as a state versus a trait. So a state is the fleeting day-to-day thing, but the state, the trait is like the long-term thing. So there are things that generally don't change, like attachment style or personality. Those are very stable. But the things like satisfaction or just like general happiness, those do fluctuate. And so it can be really hard. But the way that we have tried to get around that is instead of having participants report on how they feel that day, we have them report on things that have happened throughout the month. And so in that way, we hope to get less of a reflection of like how they're feeling in that exact moment, and more of a reflection of like what has happened since the last survey. But again, certainly we have no way of knowing how each person interpreted that. So that could totally be something that happens for a lot of them. However, in a sample of 1,400, if some people, have that mood swing from day to day, it's not actually going to change the overall like average of the sample. And so there is some room for that kind of stuff without it really messing up the statistics at the end of it.
Okay, great. And then in addition to trying something new with your partner, communicating with your partner, some of the students were asking about, at this moment, you have some people who are confined, or at least mostly living in a pretty small place with their partner. And given those confines, do you have any other advice aside from trying to communicate and trying to do something new that can help improve their relationship?
It's really hard to come up with it, because everyone's home life is different and everyone's work life is different, and people have kids and elderly family members to care for and whatnot. But the things that I have seen come out in terms of studies done by like counselors or therapists or people who actually like practice like therapy and trying to help people feel and be better. The things that I have seen from that, beyond like the doing new things together and then trying to openly communicate, it seems to be, the biggest one seems to be just taking time for yourself, which I think is especially hard for people who are a little bit older, a little in a bit more advanced life stage than people who are the typical college age, because they might have children, they might have 40 hours a week plus children. And so I think taking time for yourself is like kind of a privilege. But if that's something that you can do, I do think that that is quite helpful, even if it's just because finally you'll have something new to say to each other, like you experience something separately that you haven't done for a year. So there's always at least that benefit to just have something new to hear.
Absolutely. So the question that's a little bit off topic, but I think it's a pretty good one, and so I'm interested in hearing your answer. They asked, how do we ensure safe sex practices are being maintained to where everyone in the situation is giving their full enthusiastic consent? How can we check in with people? And I mean, this is something that I think we both feel strongly about, so I think it's great for us to talk about that here.
And not during COVID, just generally?
Yeah, but I think, we should be doing it during COVID.
Yeah, I just meant like in general life.
Yeah.
Of course. So important, definitely. And honestly, I think what's really cool is that I think that the younger generations of people actually feel more comfortable with this, I guess. Like, certainly my parents' generation and even my generation never talked about consent, and only just now are we talking about it. And we're so far along in our lives now that like a lot of people are set in their ways. Like these people aren't going to start changing and asking people at the beginning of something that they've been doing for 30 years. But I think that's so promising to see that people are actually taking consent seriously. And it does seem to be something that is really substantially important to like Gen Z and younger millennials. I think that's just incredible. But regardless, what I think is really interesting about consent is that because of that, it actually isn't as awkward to bring up as a lot of people think it is. And I know this because there were a few papers looking at like before and after people had like forced themselves to have these conversations. And people often reported that it was fine, like that it actually made everything better because now you're on the right page and I don't have to worry about this. Like, I don't have to worry about how I might feel afterwards. I don't have to worry about asking you to wear a condom because we already talked about this at the beginning. And so I think that, it is certainly an awkward conversation that a lot of people try to avoid, but we all have to have awkward conversations in our lifetime. And it's just one of those things. And so in terms of like the consent conversation, obviously it's something important to talk about beforehand, before you even get started. I have some friends personally who have like brought this up even before the first date, like on the online dating app, texting or whatever, where they've talked about like, hey, this, just so you know, like I'm not going to have sex with you on the first date, or like, just so you know, this is what I'm expecting, or this is where it might go tonight. I don't know if that's what you're into, that's what you're looking for. And I also have friends who have had this conversation, while they're like, on their way there. Like they might be in the car, or they might just be, in the house before they move to that step. But the point is, obviously everyone is going to feel awkward talking about it at first, but as soon as you begin talking about it, I think that awkwardness goes away because everyone thinks that this is important. And obviously if there's someone in that situation and they don't want to do this, and you just ask them if they do or don't want to do this, you're just giving that person such kindness to be able to have that out, I think. And so I think that it's just really important to force yourself to get over that awkwardness, because it's really not that big of a deal. Also, it is really important to continue to check in. I do have some friends who have like complained that it feels annoying, it feels awkward that someone's like continuing to ask you if you're okay after you already said it once. And I can get that. I understand that it's like, you don't want to be, if it felt awkward for you the first time, you don't want to continuously be reminded of the awkward thing. But I think it is good to have at least, just the one check-in, and it doesn't have to be, like a full stop, do you consent? But you can at least just in the moment say, hey, like, are you having a good time? Is there a way that you can phrase that where it's not awkward? Can you check in to make sure that that's what they want? You could even just say, hey, is there something different you would want? There are different ways to ask that where it's more focused on doing something good for the person rather than having a conversation that like alludes to something negative.
Yeah, absolutely. I really appreciate that the question said enthusiastic consent, because I do think it's so common for older generations to think of this as like, oh, it really dampens the mood, right? I don't know how many times I've heard this said, or yeah, it's like it kills the vibe or whatever. And absolutely not. Like this can be a very enthusiastic concern. Doesn't have to slow anything down. And I think also to your point about like, maybe it's awkward at first, but you know what, if you do it every time, if before you have intercourse every time, it's, do you want to have sex? Yep. Okay. Then that's like not awkward, and that's not slowing anything down. And now you know that both people are on the same page, you know? So I really appreciated the wording of that question. And I agree. I think like frequently checking in, as you were saying, like, you know, you may want to discuss this up front, but then it also needs to be a discussion, not a discussion, but, you know, checking in, which doesn't have to be this huge, let's completely put on the brakes, turn on the light, have a serious, you know, face-to-face. Yeah, that's great. And I think now, you know, in this class, we've talked about just the need to have a lot of communication about what's going to happen if you are going to be in person with someone, you know, an outdoor walk or whatever, just laying out the ground rules up front. Obviously, if you're going to be getting together for any sort of sexual interaction, then that's just layered in, and you can kind of work on all of these, the communication around all of these safety things as one. So this has been really wonderful. We only have a couple minutes left, so I just wanted to ask, is there anything else? We have, you know, a couple hundred undergraduate students in this class. If you were going to give them any last piece of advice about navigating sex and relationships during the pandemic, what would it be?
I think my piece of advice for navigating relationships and dating or anything like that during the pandemic is, first of all, realize that everyone else is feeling exactly the same way. If that's awkward, everyone else is feeling awkward. If it's stressed, everyone else is feeling stressed. If it's like dying for human connection, everyone else is feeling the exact same way. And so I think just being able to get over that and realize that everyone else is feeling the same way will help to quell some of that awkwardness. But I would also say, you know, it's going to end at some point. Just give it a little bit of time. Don't be so hard on yourself. I do think that there are going to be a lot of opportunities for dating after the pandemic, you know, becomes less threatening. Lots of people are hoping for that and looking for that and waiting to make that connection. And so I think that if you can just give it a little bit of time, then it'll be ready for you when it gets there, basically.
That's a good positive message of hope here at the end. Wonderful. Well, thank you so much for your time. We really appreciate it.
Thank you so much. I had a great time. Thanks to everyone for listening.
Thank you. All right. So for everyone else, we will be back here next Monday. Until then, stay safe.